Welcome, everyone. Thanks so much for coming out to join us. I'm so excited to kick off our healthcare panel. Over the past few years, especially in the wake of COVID, many Texans, many Americans have taken a harder look at a healthcare system that too often feels opaque and unresponsive to the people it is meant to serve. And the Make America Healthy Again movement reflects a renewed focus on restoring trust by putting patients back at the center of care and reaffirming the role of personal responsibility in health. Today's conversation is about what it looks like to build a system that is more transparent, more accountable, and ultimately more aligned with the needs and choices of individuals and families. I have a great panel of all-star policymakers, both our state-elected representatives and federal policymakers, to elucidate healthcare triumphs and opportunities, how to make Texas healthy again. I'm gonna introduce our panelists. If you can reserve applause till all of them have been introduced, that'd be great. So first we have Hannah Anderson. Hannah is a native Texan from Spring, Texas, and she returns to AFPI as Director of the Healthy America Policy, as well as Senior Director of Policy. Prior to AFPI, Hannah served as the Deputy Chief of Staff for Policy at the Department of Health and Human Services. She's also served as a Health Policy Advisor for U.S. Senate Health, Education, Labor, and Pensions Committee, advising on prescription drug pricing, commercial health insurance coverage, and other private health programs, as well as working in the U.S. House of Representatives, advising on healthcare policy and other domestic policy issues for members of the Energy and Commerce Committee. Hannah, thank you so much for joining us today. Next to Hannah, we have Stephanie Carlton coming to us from DC. Stephanie Carlton was appointed by President Trump to be the Centers for Medicare and Medicaid Services Deputy Administrator and Chief of Staff. As acting CMS administrator until Dr. Oz was confirmed by the Senate, Stephanie has led the agency through the early days of working with DOGE, implementing executive orders, and running the $1.7 trillion budget. I do not envy you. When a partner at McKinsey & Company, Carlton was a leader in the SHAPE practice with a focus on innovation and strategy, and led McKinsey's Center for U.S. Health System Reform. She has also co-founded a place-based transformation with community leaders in Texas to improve holistic health outcomes. She has led Medicare Advantage and Medicaid issues at U.S. Senate Finance Committee, as well as working as a labor and delivery nurse right here at Georgetown University Hospital. That's not right here. I read Georgetown. It's the Texan in me, guys. She has served on the boards of the Healthcare Cost Institute, Ignite Health Foundation, and the University of Texas McCombs Alumni Association. Huckum. Thank you for joining us. We have the Honorable Chair Lacey Hull, who, by the way, guys, is stepping out of a committee hearing to join us here today. So thank you very much for that. We are so honored to have you here today. Rep. Hull is a native Houstonian who was born and raised in House District 138, attended Spring Branch ISD schools, and earned a bachelor's in poli-sci from the University of Houston. She currently serves as chair of the House Committee on Human Services, which covers issues about which she is passionate, including child welfare and services for Texans with disabilities. In 2024, she was appointed to serve on the powerful Sunset Advisory Commission, hugely important, which audits state agencies and programs. Rep. Hull, Chair Hull, has championed legislation to make Texas healthy again by promoting nutrition services, education, and consumer transparency, protecting victims of crimes, particularly against women and children, safeguarding children online, and providing protections for the rights of families in the public education and child welfare systems. Thank you for joining us, Chair Hull. And last, but certainly not least, we have Representative Helen Kerwin, who is a member of the Texas House of Representatives for District 58, which includes, I think, Johnson and Somerville counties. A longtime resident of Glen Rose, Texas, Representative Kerwin built her career as a small business owner and operator in the hospitality and retail sectors. Early in her professional career, she purchased and restored the historic Glen Hotel before she later owned and ran a successful flower shop and a bed and breakfast. That's great. Rep. Kerwin's public service began at the local level, where she was elected mayor of Glen Rose, later becoming the first Republican Somerville County Commissioner. She served on the North Texas Council of Governments Executive Board and has been recognized for her contributions to the community. In the Texas House, Rep. Kerwin serves on culture, recreation, and tourism, as well as the public education committees, where she brings firsthand experience in local governance and small business to state policymaking. Guys, please welcome our wonderful panelists with me today. Well, awesome. Chair Holt, can you help us kick things off by telling us a little bit about SB 25? This is a bill that you championed last session and is now enrolled into law, which is Texas's landmark legislation regarding health and nutrition standards in education. Tell us about how you got interested in this, what it does, and the results you hope to see.
Yes. Thank you, and thanks for having me. And I also wanted to recognize Representative Richardson, who's here. She's on Human Services too, an incredible member of the committee, and just wanted to point out that she's here. So yeah, SB 25, oh my gosh, I love that bill so much. I like to say that I was MAHA before MAHA was ever a thing. And so before it was not cool to be MAHA. And so I was like, oh my gosh, we finally get to work on these things and talk about it. And so working with Senator Colhorst on this issue, and I was like, oh my gosh, I have this Senate counterpart who cares about this too. This is incredible. So the bill does four major things, and one of them is the education piece. So returning K through 8 curriculum, our health curriculum, to include nutrition. It did at one point, and then that was removed. And so we are making sure that kids K through 8 are learning about nutrition, and then there is a high school elective that districts can choose how they implement on nutrition, and then making sure that all in the medical industry and medical schools and are learning about nutrition, and continuing education for doctors and nurses and dietitians are learning about proper nutrition. We also created the Nutrition Advisory Council. It's temporary, just so we can bring in some real data and information. And thankfully, the federal government, we flipped the food pyramid, which is incredible, but at the time, that had not been done. And so the goal is to bring in some real information to help guide all of the education on real nutrition policy. And so that's really exciting. The other part is physical activity. We know that kids need to move during the day. And so it's PE requirements for elementary kids, and also making sure that recess and physical education cannot be removed as punishment for disciplinary reasons. You have to find something else. Removing recess and PE, we know, only makes situations worse, whether it's behavioral issues, physical health, mental health, all of that. So we did that, and obviously the most talked about and controversial part of the bill is the labeling requirement. Making sure that food that is sold in Texas, packaged food, if it has an ingredient that is been deemed not fit for human consumption in another westernized country, that is on the label. We know that, and we knew at the time that Big Food and Big Chemical were gonna come out and sue, and they did. There is an injunction, but we are hopeful that the state ends up winning. And I also know that the federal government has already been acting, and so I am very hopeful that the public transparency part of that bill, as far as labeling, will move forward in some form or fashion. I like to joke that bill, I called it the Lobby Employment Act of 2025. Because entire organizations were created to kill that bill. Lobbyists, and people picked up from DC to Austin and formed organizations to kill this bill. So I joke that we helped employ a bunch of people for, yes, exactly. So I am so thankful that Senator Colhorst and all of my House members who worked so hard, and I know there was a ton of pressure to vote no, and I am so thankful, and for the governor who had enormous pressure to veto that bill. And so I'm just incredibly thankful that we were able to get that done and be an example for the nation. So
That's awesome. Thanks so much for your leadership on that chair hole. I want to give Rep. Kerwin a chance because I know you supported this as well, just to add anything about SB 25 that you enjoyed or.
Well, just can't begin to tell you how significant I think this legislation was. I have watched the nutrition of the two generations that came up behind my daughters, and the almost being victimized by the additives and the processing, and the lack of knowledge that people had and were given in our culture to know what it was doing. And we finally have the studies and the warrior right here who took it on and opened the door, and I am so excited for the next session to see how much we can do with this. It's just awesome, and I think bringing the fitness back, most of you are too young to remember JFK's fitness program in the 60s, and of course the nutrition too, but we have so much against us now in our culture, so to bring this back is I think it's just amazing, and it's one of my favorite bills of the whole session, Lacey, so thank you.
Well, thank you. That's awesome. Well, Ms. Carlton, I want to kick it over to you. You have on-the-ground experience as a nurse, of course, which informs your view of healthcare. Before you even join the Senate or the admin, tell us a little bit about how this informs your view of healthcare policy.
Yeah, and thanks for having me. It's fun to be back in Texas. I've been spending the last year in the swamp, so love being back in Austin for a couple days. Being a nurse, I think there's a lot of things. Like one, nurses are problem solvers. You get kind of thrown something, and you got to go just solve it. And that's an incredible mindset to bring when you're helping Dr. Oz run a $1.7 trillion agency. But I think much more personally, nurses are the ones that spend the most time with patients in our healthcare system. And that just teaches you so much about what is going on with the system. I think there's a lot of people in Washington that go to a fancy school and kind of think they know all the answers, but until you've actually spent time at the patient's bedside or figuring out why they have to be in the hospital, it's hard to really make the kind of change that we need to see in Washington. And I think there's two big lessons that I see from my time as a nurse. One, our country is sicker. Our patients are sicker than they need to be. I love the point about just getting back to basic things that we've known for generations about physical activity. I used to live in Dallas until about a year ago, and I'm about 10 minutes away from the Cooper Clinic in Dallas. Literally, he revolutionized the idea of aerobic exercise and how good that is for our bodies and living longer and our fullest lives. And I think getting back to that is a core thing. The other thing, just eating good nutrition. We've just stacked our grocery stores with ultra-processed foods. I love the reforms we're seeing in Texas, and we've seen it in many other states follow Texas' lead that we're really excited about. And making sure public SNAP dollars don't go to pay for junk food that's making people sicker. And so those kinds of basic things are things that are really important for nurses to be telling their patients. And when you bubble it up and to see the potential that we have at a national scale to change policy, that's what gets me really excited. And I'm really grateful for my time spending time with patients at the bedside.
That's awesome. Thanks. Hannah, I want to follow up on something that Stephanie mentioned, actually, which is the SNAP waiver implemented in Texas actually on April 1st, so it's pretty new here. Can you tell us about the purpose of SNAP and what this waiver does, what that change will mean for Texans or other states who've adopted this policy? I think
Absolutely.
21 others.
Yeah, 21 others, and it's amazing. And again, under the leadership of someone you might know pretty well, just a little bit, Secretary Rollins, has really gone out and encouraged states to take these dollars, which are used to make sure that every family in America has the kind of food that they need to have healthy lives. And I really, I gotta commend y'all in Texas, because that probably was a really tough decision. I know as a Texan, we don't like to tell people like what to do or what kind of food to eat. But when you're seeing this like chronic disease crisis, you're seeing, what Steph was saying, where kids are getting 60 to 70% of their calories in a day from ultra-processed food. You're seeing the impact on hyperactivity from additives. You're seeing the impact on the Medicaid dollars in the budget and just the quality of life. I think that's why Texas said, you know what, we have to take the boldness to act. And so again, I really want to commend y'all here, because I don't imagine that that was the easiest decision to go and say, you know what, we do want to take some of these things off the SNAP waiver. Off SNAP and apply for the waiver. But I really think that this is such a bold and game-changing decision that y'all were able to do, and that's going to actually have a real impact on kids, because, you know, it's like what you were saying, you know, this is just giving so much money to the lobbyists who are coming back into Texas and saying, hey, you can't do this. But that's what's so sad, is so many of these federal programs that are intended to feed the most unfortunate and people who are really struggling, it's been captured by people who really are looking to serve their bottom line and their interests. And my mom's in the audience, so thank you, Mom, for being here. Last time she saw me was a high school production of Charlotte's Web, I think, you know, and so this is much better. But my sister spent a little time as a social worker in Sunnyside in Houston, and she would tell me during that time that it was convenience store trucks that would go around neighborhoods, and they would take your Lone Star card and, one, overcharge you for really, really crappy food, but then two, serve you really crappy food. And I think this, again, is just going back to basics, is making sure that no one is freeloading off even of our food system to feed our kids really unhealthy junk food, and hopefully turn the tide and really getting Texans back to being healthy.
That's awesome. Thank you. Chair Hull or Rep. Kerwin, I wanted to give you guys a chance to talk about what it was like implementing that SNAP waiver at the state level. What inspired you to try and pass that waiver?
You know, that bill had been introduced, I think Speaker Burrows was actually the first one back in 2017, I think it was, to file the first bill to remove some of the stuff from SNAP. So that bill came through my committee, through Human Services. So Representative Richardson, also, we sat through that hearing, listening to all of it. So it's always a very interesting conversation. I'm really glad that Texas, we got that done, removing it was very easy to be able to remove the sweetened drinks and sodas and candies, and because that's a no-brainer. So these people can hopefully make some healthier food choices, and you know, I'm so glad that we were able to get that done. It was pretty incredible, and I'm glad that the federal government acted so fast in accepting our waiver, so we can hopefully have some preliminary results before next session. So.
And I would like to see it go even further the next session. I would like to see vending machines addressed. And I would also like to see parents would have a choice to actually opt in or opt out for all the kids in the school about having these processed foods available to them every day to buy, so that they know what their kids are actually eating and what choices they are making.
That's cool. Well, staying with you, Rep. Kerwin, you've worked on policies addressing some of the environmental factors of health, and I want to dive a little into that. One of the things you worked on was forever chemicals, PFAS. Can you tell us about what inspired you to get into that fight and what needs to be done?
Yes, that I actually didn't even know what PFAS was, and my district is Johnson County, which is Cleburne, Burleson, and then of course Somerville with Glenrose. And the very first commissioner's court I went to sat in the back row trying to absorb Johnson County politics. And this lady got up with a presentation on PFAS and forever chemicals regarding testing on a farm in southern Johnson County near Grandview. She had tests, she had flower vases where the white carnations gradually, with exposed to the water runoff from the farms, had turned from white to tan to brown. I mean, I was stunned. So I took that on, heart and soul, got 76 signatures actually of representatives, the majority of the House. It had never gotten out of committee before. And so the chair, Rep. Landgraf, actually enabled us to have a hearing, which was really historic. Here's the deal, though. What I learned about it is that it is so big and so broad. It is not only land application, which is what I was trying to handle with the crops, the runoff, the PFAS chemicals on our croplands going into our food, but also the ranchers, the grasslands, the consumption from the cattle, et cetera. We were consuming it, but then I also learned on my journey that it is in the air, it is in the water, and it is in household products. So I plan to continue the fight, but we are going to need much more conclusive evidence from all the areas of Texas. It's quite a mountain to climb, but I think that from what I hear in my district and my constituents and what I'm hearing all over Texas, people are becoming educated on it. They're becoming aware of it, not only food, which was my big concern, but all other areas in our culture.
That's great. Thanks so much. Ms. Carlton, can you tell us something about technology? This seems to be a big topic in everywhere, as well as healthcare. What role does technology play in creating a more responsive, patient-centered healthcare system, and what innovations in this area are you excited about?
Great question. So I talked a little bit about what I've learned from patients and just that they are sicker than they should be. The other thing I hear from patients is healthcare is way too expensive in America. And I will be the first to say some people blame it on having a private healthcare system. I think that's not true. It's because we have Washington interfering so much in a private system that has driven up the cost of healthcare. And so one of the things I am really excited about is the potential of technology in healthcare. And if you've spent time kind of in the healthcare arena, unfortunately, sometimes technology means it's going to be more expensive. And I would say that's, again, a direct result of some of the policies in Washington that are all these perverse incentives. And so we're working on that. I would say one of the most powerful technology tools that we're working on now, in fact, I'm missing an event in DC today that is about consumer-facing technology apps that could be on your iPhone that actually give you the potential to have an AI doctor of sorts on your iPhone or on your smartphone, whatever you use. And think about the power of that is really transformative. Having it 24/7, and think about you get your Amazon Prime or your Netflix or whatever 24/7, and it kind of knows you and what you like, and it personalizes recommendations for you. We don't have that in healthcare. But think about what the power of technology can do to say, oh, actually, you shared your medical records with me. Have you noticed this kind of trend? And maybe you want to start getting out and walking every day. That's going to really improve your BMI or whatever it might be. Or, hey, we're noticing you've got this blood pressure monitor. We're noticing a little problem here. You might want to go call your doctor about that. But some of those things that technology can help us solve right now, or asking questions. I had a migraine yesterday, actually, and started asking questions of an AI bot. And it was able to kind of nail down exactly what I had and give me, oh, yeah, this will be over in about 36 hours. I actually checked it with Dr. Oz. It was right. And the power of that is really exciting. The way that we are going about it is not having the government try to make these apps, but rather really encourage entrepreneurs and the private sector to do that. What we're trying to do is get government out of the way of that, and then correct the incentives so that they're not getting in the way of private sector innovation. As an example of that, your healthcare data, it's digital for the most part today, but it's not connected for you. If you go and visit multiple doctors or multiple hospitals, you have to kind of log into each one, pull it down, then log into a different one. I have a friend who has like literally 30 different logins. Think about how hard that is when you actually need to show it to your doctor and say, hey, I had this medication. Can't really remember what it was called. That's a technology problem that's really easy to solve. And there's ways to protect that data, and that's really important because it's your data. You should have the right to keep it private if you want to, and if you want to give it to an app and you're sure it can protect that data, you should be able to do that. And again, once you can kind of connect all your data and put it in one place, that's when you can use different tools that are coming out with AI that can give you really helpful medical advice. And I would just point out some of the things that we're seeing this year. And again, this is happening at light speed. We've actually got AI tools that are doing better than humans are on different medical exams. They're doing better at diagnosing really complex medical conditions. better than humans can. And again, my dad's a doctor, I'll be the first to say it, and we're not gonna replace humans, but think about how much that expands access at a dramatically lower cost for patients in a much more convenient way for patients. Think about 24/7 kinds of access. So they're literally doing what we're calling a minimum viable product demonstration today in DC. You should check it out later, where they're allowing different private sector companies to come in and show the kinds of things they're doing that can be used to improve your health. And then this summer, will culminate in a really big event on some of the things that are a breakthrough from the Trump administration.
That's exciting. Hannah, kind of building on this framing of keeping healthcare patient focused, a good response, I think, to worries about kind of quality of care, whether that be vaccines or nutrition or the appropriate cost for a procedure, is to have solid, transparent data so that those patients can make an informed decision. Can you expand on that a little more? Maybe tell us some of the ways that the healthcare system can or should shift to empower patients?
Yeah, I mean, this is all what we talk about at AFPI. We're very patients first, so very focused on like how can you help you or I actually be better consumers of healthcare. And healthcare, as Steph has pointed out, y'all have pointed out, is really hard to understand, consume because of, my data doesn't talk to each other. My doctor's not available 24/7. I can't get the information I need from when I need it. And what I'm really excited about is the secretary, the administrator, the team at HHS, the president are really focused on patients and people. So, it's everything from what Steph is saying on technology. I remember showing Secretary Kennedy, I've got a Whoop, I've got an Oura Ring, I've got a little patch over here, I've got function. I've got anything that can tell me more about who I am and what kind of diagnostics are being run 24/7 on me. And I remember showing Secretary Kennedy all of this information, and one, he was a little alarmed at the amount I wasn't sleeping. But we were setting up a department. It was a lot of work. So
Hannah's tough. She works hard. The secretary trusts her implicitly. It's really incredible.
I appreciate that. And so it's funny, he's looking at all these things and he's saying, wait a second, I wish everyone could have something like this. And what I realize, and what, again, I think all of us realize as we have, all these little devices, is that this is the first time that I've been able to get real-time diagnostic information on myself without having to be sick and have to go to the doctor and then get a 12-panel CBC that gives me this amount of information, when in reality, I can go somewhere else and get 100 or 200 different things tested. And that's something that I have decided Hannah Anderson has value. It's not a third party deciding its value. It's not the government deciding its value. It's me saying, I value my health, and I can make an appropriate justification for the health dollars that I'm going to spend through my HSA, and say, I want to understand what is my entire cholesterol panel, what is my entire, everything that could be cancer screening or preventative. And what I think is really frustrating about what we're doing right now in healthcare, and what we've done in healthcare, is we've given more and more control over to third parties to dictate that, whether that's the government under different administrations, or that's third parties in the private sector. And so I'm really looking forward to all the different changes that are being made. One of the ones that I think hasn't gotten a lot of attention is a change that was made between CMS and something called ASTP, which is the Assistant Secretary for Technology Policy. And so one of the really frustrating things that I've noticed when I go to the doctor, they say, hey, where do you want to send your prescription? And I say, well, I don't know. I guess the CVS. Where do I send it? And they say, yeah, sure, here you go, okay. And I show up at the CVS, and I say, okay, I have whatever insurance, and they adjudicate my claim right there at the pharmacy counter, and they say that will be $37. Okay, whatever, $37, that's not bad, I guess. But Trump changed the rules so that pharmacist could tell me that actually the cash price for that drug was $3. So now I can use my HSA and pay $3 instead of $37. But what the ASTP with CMS did, sorry, acronym central here, but they said now in your little health record, your doctor can sit there with you and say, hey, you can get actually a better deal, not sending it to the CVS, but the local pharmacy down the street. The $37 is the CVS price, $5 is the independent pharmacy price, and oh wait, $3 is the cash price. And so all of that, they've finally allowed that to be baked in right there at the doctor's office, which is incredible. And again, this has real world applications. You know, over Christmas, my grandma unfortunately had to go to the hospital because at 85, they send you to the hospital for everything. And we're trying to get discharged out of the hospital on Christmas Eve. We're trying to beat the clock so that grandma can be out of the hospital on Christmas. And I am on the phone. They send her prescriptions to a pharmacy. Again, the CVS, sure, why not? And they're not ready to be picked up. And I'm calling and calling and calling. And they say, well, we haven't heard back from your insurance. I said, oh my God, okay, what is the cash price? It was like $8. I say, I'll pick up the tab for that one. We went to the CVS right then and there, got grandma her medication. She made it home for Christmas Eve and Christmas, and we were able to have family Christmas. These are like the real world applications that I know Dr. Oz and Secretary Kennedy and the leaders here on the stage, they're thinking through, because it's not macroeconomic healthcare third party nonsense. It's how can we actually make healthcare better for patients on the ground with kitchen table math. And so, you know, a lot of the changes that we're seeing now are helping with that.
That's awesome. This is very exciting. Thank you. Well, Chair Hull, you have not only championed nutrition education, like we talked about a little before, but also reforming some of the systems around healthcare, allowing patients to choose better, healthier options. Some of these include HB 26 or 136 that you championed last session, allowing Medicaid to cover different types of options for patients. Can you tell us a little about what these bills do and how they help reform the healthcare system?
Yes, thank you. So HB 26 has to do with nutrition education for those enrolled in Medicaid. So the goal is, especially with changing the SNAP benefits, to teach people about healthier food choices and how to cook these foods. A lot of them have no idea. And so when they are receiving state-funded benefits for food and healthcare, it is very important, and we have a very vested interest in making sure that they know how to make these healthy food choices. And so HB 26 is an in lieu of service. So that means it is not a full benefit. It has to be medically necessary, cost neutral, and in lieu of another covered benefit, like something, prescription or dialysis or treatment for some chronic health condition. And so the goal is to have people, the goal is to change generations into where people are learning how to make and cook healthier food options. Part of that bill is also a statewide pilot program to, I believe that ends in 2030, and then a report comes to the legislature for medically tailored meals in partnership with nutrition education for high-risk conditions of pregnant women that are enrolled in Medicaid. And so the goal is to see, by 2030, what are the benefits? What are the health outcomes and benefits for those women who receive that? So trying to gather more information. We know that nutrition, obviously we were talking about SB 25 and all of going back to basics. And so that's the goal of that bill. And then 136 has to do with lactation consulting. We know the proven scientific benefits of breastfeeding for mom and for baby. And again, when the state is funding all of this, having mom and baby with better health outcomes long-term is better and cost-effective for the state. But also, you are having, instead of going and paying, and I know it's WIC versus Medicaid, but still taxpayer dollars that would go to pay for formula, instead, that a couple visits at a lactation consultant is far less expensive than a year plus of formula. So again, it's these long-term overall health outcomes for mom and baby, plus an overall long-term cost benefit to taxpayers.
I like that, thank you. Kind of building on Medicaid, Ms. Carlton, can you tell us a little bit about how we measure quality in the Medicaid program and measure real health outcomes while also trying to reduce that regulatory burden?
Yeah, and by the way, I would just say one thing President Trump has been very clear about is that he wants to love and cherish the Medicaid program. It's a really important safety net for vulnerable Americans. To do that, we didn't want to let the status quo stay as is. And we actually last year passed with Congress one of the most historic Medicaid reforms ever. Some people say we cut Medicaid. We actually didn't, if you understand math. we slowed the growth of the program and it tried to manage its growth. It was growing at more than 7% a year. We just said, let's maybe bring it down a little bit more, like 5%. That's a little bit more sustainable, but still make sure we can give people the benefits and the care they need. But one of the most important things that we're doing now is looking at how we get into quality in Medicaid, and there are different measures that we'll need, that plans that are providing Medicaid services, and there's like private plans that participate in Medicaid, and they're responsible for delivering on certain quality measures. And we'll say, hey, did this child get their pediatrician's visit at the right time, and different things, and plans will report back to the states, and then states actually do some reporting back to us at CMS. But as we looked more and more at it, there are a lot of measures that are across the country. Every state has its different version of them, and at some level that's good. At another level, if you look at the data, most of them are very compliance-oriented, and they might be kind of checking a box or pushing reporting from different providers, and there's a whole lot of them. It's really complex. And what we've heard from talking to states and from talking to different private plans that are participating in the program is that becomes a compliance exercise and a regulatory burden, and it's actually a distraction from them really investing strongly in health outcomes in the Medicaid program. And so what we are starting to do, and there'll be more on this in the coming months, is to work with states, to work with the private plans and say, help us figure out the measures, the quality measures that will get at primary prevention, right? Those things that we were talking about earlier, physical activity, how do we make sure a pediatrician is doing the right counseling with their patients to talk about the importance of that, nutrition, again, getting ultra-processed foods out of kids' diets and really helping them understand how to eat fruits and veggies and how important that is, some of those primary prevention measures, and then for the kids that get sick or struggle with something like obesity, how do we not just check boxes and say we identified obesity, but how do we actually help plans move the needle and improve the crisis that we've got with childhood obesity? So that is something we're starting to work with, again, states and private plans on, and we'll be rolling out more this summer. But to us, it kind of gets at the heart of, this is what the Medicaid program is for. We're conservatives, we don't believe in over-regulating, but we do believe in holding players accountable for the results that they deliver through the Medicaid program.
Thanks so much. Well, Hannah, shifting gears a little from Medicaid, I wanted to touch on another hot button issue in healthcare, which is drug affordability. So I think one or two most frequently polled issue in healthcare is, why do my drugs cost so much? What are some solutions that we have to reduce prescription costs? I mean, you brought up cash prices earlier, as in the example of your grandma. Are there other levers that we can pull?
With my no, I'm just kidding.
Well,
no. So, everyone here knows I have a love letter to Trump RX, because that is cash prices
That was
right
Hannah's
there.
idea, by the way.
No, that was Secretary Kennedy's idea, Stephanie. I love Trump RX because it's going back to no more middlemen, no more nothing, just the actual price of the drug. And I love it so much because if you're thinking about a drug like Humira, which was just listed on Trump RX, it's a drug that's list price is $7,000. So that means that if you have a high deductible plan in Texas and your deductible is anywhere from $2,000 to $3,000, you're testing me because I'm doing math on stage now, you are paying the full list price of the drug for the first 2 or so months that you were on that drug. But what if your insurance says, actually, we'd like you to try a different drug. Instead of Humira, we'd like you to try a different biologic like Remicade, which is also a treatment for ulcerative colitis, rheumatoid arthritis. These are conditions that are really hard to switch. And so if anyone is on those kind of drugs, you know that you don't want to switch off of it. So your insurance is going to say, actually, I need you to do step therapy before we'll pay or cover after you hit your deductible. So you've paid now, I don't know, $6,000, $7,000 before your deductible, to hit your deductible. And even after your deductible, your plan's going to pay 27%. And again, we're doing math on a stage, so $2,000 maybe, I don't know, I'm guessing. And that is still really tough for families doing kitchen table math. And so the DC folks and people who are really in love with like insurance managing all of these costs once and for all, they say, well, it's great because you're going to hit your deductible and then you're not going to have to pay for that for the rest of the year. It's great, it's great, it's great. Except people aren't doing like over 12-month math. I mean, healthcare costs are the number one thing people are thinking about according to this recent Gallup poll. They're thinking of how am I going to afford it this month? And $6,000, $7,000, $2,000, that's still a lot of money, even if your insurance is covering part of it. So Trump RX being able to cut that down to $950 through reducing freeloading by other countries, and then also reducing freeloading within our system of PBMs and TPAs and all the other middlemen that are adding, we found up to 40% on the cost of these drugs. That's huge because that is money in people's pockets, that is actual affordable medicine, and that's getting the medicine that they need and that works for them. Because why should you have to step through all of these other treatments for a disease you may have had, you know, it's a, I'm gonna embarrass myself, but it's a disease that you're gonna get maybe in midlife and have for the rest of your life. Why, again, should you step through other treatments when you know what drug works for you? So really excited about Trump RX, really excited about what the president's doing in the Great Healthcare Plan and what Dr. Oz and Secretary Kennedy are doing, because that is going after the middlemen. And it's, again, getting patients the drugs that they need. It's not just about costs, but it turns out when you give patients more control and access and understanding of the costs, they actually can help drive down the cost of the drug. And we've seen that tremendously with GLP-1s. The fact that you can get a GLP-1 now that was a list price of $1,100 and you can get it for $199 because they took all the middlemen out and took insurance out of it, that's incredible.
That's awesome. And I love the step. Thank you. Yes, please. Thank you. I love the step therapy you mentioned too. I was just going to mention, I know Chair Hull has championed some step therapy reform in the past. One of our policy analysts has dealt with this before and is a huge advocate of trying to reform this. So removing the middleman, making it patient-focused is huge. Well, I know we are coming up to our Q&A, so everyone think of excellent, short, witty questions. Hold them in your pocket. And I'm going to give everyone a chance to tell us a little bit about what you're excited for in the upcoming 90th session if you're in Texas, or I guess the upcoming 6 months if you're in DC. I don't know what y'all's schedule is like, but Rep. Kerwin, tell us what you're excited for, what some of your priorities will be in the 90th.
Well, I just happen to have a list.
Wow, what a concept. Like you prepared.
I am very excited. Well, after what Rep. Hull did this session, and I have to say I really wasn't, I was dealing with PFAS and Texas, and I'm so inspired by her, and I'm such a big, big believer in nutrition. My poor daughters had to have calf liver twice a week until they were 5, and we had gardens and organic. I bake my own bread, and I just think it's so important, and I see the difference that, and I just didn't know how powerful that it could be done here in our legislature until I saw what she did. So I'm really excited for the next session. So my list that I have is, of course, nutritious food in taxpayer-funded facilities, like vending machines, right? We're using our tax dollars to put crap out for our kids and adults. I think that we need to reconsider those funds and how they're allocated in our Texas diets. Protect meat definitions, lab-grown meat. Come on. I mean, that's real. I want my steak. Yes, right? The labeling, which you've done an amazing job. Country, origin of country labeling. Close the school junk food loophole, which I mentioned briefly earlier. Let's get the parents involved. Let's give them the choice so that they will see what their kids have available, the choices they're making, and then promote better education at home. Fluoride, another issue. My daughters, they were brought up on well water, and now the studies are beginning to emerge that fluoride is not the end all that we thought for 3 generations. Let's look at that. Let's let the local communities get involved in that. So that's what I'm excited about.
I'm excited about it now too. Well, thank you. Chair Hull, can you tell us a little about what you're excited about in the 90th session?
Yes, thank you.
And beyond.
Yes, I love your list. Great list. Yes, my son can commiserate with your daughters about eating liver. It was one of his very first foods, so yes.
They will not touch it now. So
Oh,
kind of backfired on me.
well, I was so excited all of the things that Texas was able to accomplish last session, things that I never thought that I would ever see in my lifetime. And I am so thankful to the Trump administration and everything that with Secretary Kennedy, your daughter, Dr. Oz, everything that all the direction of all of that, again, is things that I just never thought I would see. So I don't have specific things. I love the list that she talked about. I know that last session we got artificial dyes and some ingredients out of school lunches, but I would love to see going a step further, like what you were talking about. But I know that we have a great partner in the Senate with Senator Kolkhorst. I know she is so passionate about these issues too. So is the Speaker, and I know clearly the governor cares, and we have our Texas House MAHA caucus, and so I look forward to continuing to partner with everybody. And we just took the Texas House Republican caucus and the Senate Republican caucus. We just took a little class field trip to DC, and Secretary Kennedy spoke to us and was talking about how Texas really is leading the nation and how the bills that have come out of Texas have been incredible and an example. And so I just look forward to continuing to do that and partner with the White House on these ideas for next session. So
I love
thanks.
it. We love to see Texas leading the way.
Yes, definitely.
Well, Hannah, tell us a little bit about what priorities you're excited for in your near future.
And this is great because my priorities, I get to pitch them live here in Texas and CMS. My background is private insurance policy. Just really, everyone will immediately fall asleep. But there are some really unused authorities in what's called Title 27 of the Public Health Service Act. And those authorities really let the government open up and deregulate things like wellness benefits and health contingent health plans and health outcomes. So what I would really love to see and what we're working on at AFPI is basically what is a new system of finance for preventative care? Because we've really been trying to put preventative care in the system of like health insurance and like health payment that is really challenged by like, again, the underlying underwriting. So if you're talking about how do you, like insurance is saying, hey, what is the risk of you going to your primary care doctor? Well, it should be very high. You should have a high risk of going to your primary care doctor for a checkup. You should have a very high risk of going to your dermatologist for a checkup. You should have a high risk of that, except we're using health insurance to try and get people to go to the doctor for preventative care checkups. And what's been really hard is you look at things like the USPSTF and other institutions and using insurance to underwrite these costs and finance it. You've actually really had a stagnant preventative care and primary care system because it's held it back because the government's had to decide what is prevention, what is primary care, and what we'll pay for. So at AFPI, we're working on what is a new system under some of these different authorities that have been unused. And thankfully, since we have CMS on the stage and great Texas legislators, there is authority there to let, under ACA demonstration, you can do things like wellness benefits for people who are enrolled in Obamacare plans. You can offer them more benefits through that, and they did that actually in Trump 45. So I'm really looking forward to helping build that out and things like wellness benefits, which would allow, the 190 million people who get a private healthcare plan, and many of those from their employer, actually unlock another system of financing for preventative care. Because truly, we should have the most innovative preventative care, the most innovative ways to prevent cancer, and we don't. We have a really strong way to treat diseases, and we have a really poor way to prevent them. So AFPI is looking forward to working on that.
That's neat. I like it.
And you should too. I get to lobby them right on stage.
That's perfect. Stephanie, to close us off, can you tell us what healthcare priorities you are excited for?
Yeah, your timing couldn't be better. We actually go through a strategic planning process at CMS. It's something a lot of us have spent time in the private sector, and disciplined strategy is key to running a business, and so we wanted to bring it to government. So we just finished sharing with all of the CMS staff what our priorities are for this year, and there's three very simple public-facing ones. The first is we want to crush fraud. That is a massive drain on resources that take dollars from either taxpayers or the patients that those programs are intended to serve. The second, we're to make America healthy again. There's a lot of different ways that looks, and what we're doing, we actually are working on ways that we can get hospitals to offer healthier food to their patients, as much like was mentioned earlier. So make America healthy again is a huge, our number 2 priority there. And our third one, is really about affordability. Again, if you think about in America, we spend twice as much as other countries, westernized countries do. We don't believe that has to be the case, and we believe that by unleashing market forces in healthcare, we can get better outcomes for our patients and lower the cost. So that's our third. And then the fourth is about how we manage a $1.7 trillion organization. And there's 2 things that we shared with our team yesterday. One is we want to use technology, and specifically artificial intelligence, in helping make our workforce more productive. There's a lot of things as we're asking public servants to do really hard work and do a lot of it with us, and helping them use tools that make their day-to-day lives even easier, and we can accomplish a lot more with limited resources. And then the second is thinking about new talent models. I've got a lot of friends that have done Teach for America, where they might not have thought about a career in teaching, but they might come for 2 or 4 years and serve in inner cities, in lower income populations, and just make a huge difference. We love the idea, kind of borrowing from that, to think about not everyone has to spend their whole career in public service, but you might come spend 2 to 4 years. And we can attract just different types of talent, like technology talent. We can bring in doctors who have just a different perspective, nurses. And so that is something that we're working on and have already started on. We had like 12 tech engineers when we started, and we've more than quadrupled that now under Dr. Oz and my colleague Amy Gleason. So that is our fourth priority that really helps us accomplish our mission.
Come work for Steph Carlton, is what she's basically trying to say.
Actually, please do. We are recruiting, so if you're interested in a tour in Washington, talk to me.
That's great. We're having legislative pitches and job opportunities. Indeed. Alrighty, well, guys, we have about 15 minutes for Q&A, and we do have some staff members with microphones. Please wait till the microphone comes to you for your healthcare policy questions. If you have a severed limb or a weird bump, talk to us, and we'll refer you a doctor outside. Okay, in the front.
Hi, so, once you've kind of gone down the rabbit hole on this topic, you kind of wake up and you're like, oh my gosh, we're being poisoned. And it's alarming. And how do you find the balance in your own daily life if you can't import your own Italian wheat berries and grind them into homemade bread every day? Where do you find, cut through the noise, find the balance in your own homes, in your own daily decisions?
So I never go on the inside aisles of any grocery store I enter. And that was a Dr. Oz lesson I learned years ago. I just go around the outside. And it is unbelievable the difference in all of the chemicals and the additives you will never see on those outside aisle. And the thing is, it is so easy now. I mean, my fresh veggies microwave, they're wonderful. I used to have to use a pressure cooker, and but I mean, it's so easy. An omelet every morning, I do it in 30 seconds. It's all fresh foods. It's just, that's I live by it, and I'm 78, and I have no medications other than my Centrum one a day for over 50. That's it. So, and I think it's because of that. I really think you are what you eat, and I don't think you're ever too late. But you know what I'm thinking while I'm listening to all this? I'm just wondering why we don't have a narrative on the floor. I didn't hear it all during the last session. Where are the preventive classes in med school? Why aren't these medical students required? I think they can take one now. That was a recent bill. But I mean, with all the studies and all the proof that we have, why aren't we looking at that? You know?
Actually, a really fun ad. This is something I think Hannah started when she was still at HHS, but Secretary Kennedy just announced a whole lot of medical schools have committed to doing at least 40 hours of nutrition education as part of their curriculum. It was groundbreaking, and we need a lot more of that, to your point.
Okay, that's awesome.
Really, really cool. It was just like last week or so.
Oh,
I think I'm next. He handed me the microphone. Okay, so we see a rise in young men in favoring conservatism. But the women, we seem to have lost young women. And I think a major part of that has to do with the issue of abortion. And I think the fault of that is that we are not educating. And I want to know how you think we can integrate education on the developmental steps of that child growing within a mother so that women are not looking at people like Charlie Kirk and saying it's just a clump of cells, it's nothing, even if it's, 3 weeks before delivery day. And I would love to see some way that you ladies think that we might improve education of our women coming up the pipeline.
Yeah, it's such a great question. So I think two things, one to encourage you and one that's pretty sad. So the first is Gen Z, there's more women who want to be what's called trad wife than ever before. I mean, these are women who are finally kind of turning around and seeing like there is so much worth in being a wife and mom and raising kids and having a good life and healthy kids and really prioritizing that. And that is so encouraging to see that the next generation has said, we really want to prioritize being a mom and that this is evil. But I think the other side of that, which is really sad, is that about a third of the Gen Z population, and it's me just remembering some math here, has been aborted. So I think you're absolutely right in what needs to happen in terms of education. I think we see everything from states that technically have ultrasound requirements on the book before you get an abortion, they're not being followed. They're not being enforced. They have really weak enforcement of the laws on the books. And so I think first and foremost, every state needs to evaluate whether they're laws that are hoping to prevent and helping to inform women to understand what really is happening, to make sure states are enforcing that. And I think secondly is just, again, making sure people know that, I'm deeply religious evangelical, but making sure people understand that there is also a science-based case to be made. So it's not just, I'm deeply devout and that's why I don't want to abort children, but also making sure that people realize like this is science staring you down at the face. How do you go from seeing it's a baby outside, but at the same amount of weeks development, it's not a baby, and making sure people realize that there's a true science-backed evidence there. And I'm really been proud of the Trump administration for recognizing that, including Jay Bhattacharya at the NIH. He's been saying, there is no need for embryonic stem cell research. Like there is other ways we can do it, and using science to recognize and get those pro-life wins.
I want to see that in the school curriculum, that development stuff. So I hope you guys can find some of it.
is there currently high school, 9th through 12th, any kind of requirements to have in public education anyway? Yeah. Classes on nutrition? Okay, I didn't know that.
Yeah. And I'll let our state leaders talk a little bit about what's in Texas schools, but I would just kind of comment generally. My dad is a physician and literally was finishing up medical school in 1973, right as Roe v. Wade was determined. And so I grew up hearing stories about how he became pro-life. And he literally said last year of medical school that he did a rotation in obstetrics, and like they had a little 23-weeker that didn't make it, and they fought like mad to try to save the little baby. And he, went through all this emotional turmoil of seeing that baby be lost. And then his next rotation was in a saline clinic. He's like, what is that? And it was literally babies the same age that were being aborted, and this was a brand new thing in our country in 1973. And my dad, seeing that, was like, this is crazy. And it was just seeing something like that visual as a doctor, and he is a committed pro-life physician. And it's actually led me, I was a labor and delivery nurse and actually picked Georgetown, the one in DC, maybe the one in Texas later.
Never gonna live that down.
But literally because it was a Catholic hospital and they didn't do abortions, because that was so important. But one of the things that was so powerful for me personally was to take care of some of these patients. And Georgetown was a high-risk center, so we'd have moms that were in preterm labor, and again, fight like mad to keep them pregnant so that the baby could mature to full term. But it was just such a powerful thing. At 27 weeks, I remember actually going into my patient's room, and by the way, babies are surviving at 22, 23 weeks now. It's incredible. But I think the more we make that real to people, I love the point about ultrasounds, and the way people can visualize and say, this is a human being that's growing inside the mama. I think that changes hearts and minds, and I think that's the most powerful thing, whether it's in schools or families, like my parents did for me.
Okay, I have a 13-year-old who was normal at birth, but at 15 months, he's a vaccine injury. He's a quadriplegic now, so that's where my questions are coming from. I just got done with a 12-year battle in the vaccine injury compensation program. And so my first question is vaccine awareness and education on your radar? If so, how? If not, why? My second is just a random one, probably for Medicaid. We're also on Medicaid, obviously, and I just wondered what the policy procedures were, because obviously going through it for 12 years, I've noticed, first off, Texas has one of the best ones in all the states. We've compared them, and it's amazing. So I love it, and I'm so appreciative. But there's also a lot of maybe like wasted programs that are amazing but not really accessible to us. So I wondered who makes those decisions. And then like another one on reimbursement hasn't been upped in home health agencies with the duration of us being on it, right? So finding care and everything is becoming increasingly more difficult because the pay is not being raised. So I wondered how all that was run.
So I think Secretary Kennedy has probably been the best vaccine education secretary in the entire history of the department. I think more people have been learning about what is and isn't studied, why we're giving Hep B vaccines to newborns. And so I think it's really been tremendous that maybe there hasn't been a formal education or, advocacy campaign, but I think more and more people are waking up and realizing, like, we actually haven't done a full study of the 72 vaccines that kids are expected to get in their 18 years.
There were many parts to that question, but I think as the legislature as a whole, again, this is an issue that many, many years ago, like I said, I was MAHA before MAHA was a thing, and so that's not something that I ever thought would be talked about or discussed, or especially on even like a federal level. I was just, oh my gosh. And even this past session, we passed numerous bills related to vaccines and information and consent and liability and all of these things. And I think one of the biggest travesties of our nation was the 1986 vaccine injury compensation program. And I understand we didn't want pharmaceutical companies to go out of business. I completely understand that. But there's been no incentive, right, for them to make safe products. And we saw the schedule grow tremendously after that, which again, I know Secretary Kennedy has been a champion of and been talking about for forever. But I think it's very well known and talked about now, especially here in Texas, in the House and in the Senate. I think the governor is aware. I think it's just a complete shift in how all of that is viewed, and parental rights around all of it, the choice to choose to fully vaccinate, to only partially vaccinate, or to not vaccinate at all. Yourself, your children. I think COVID made everyone very more well aware of that as well. And I think it is now more acceptable to make choices that were not deemed, mainstream before, to where now other people are like, wait, what is that? We're vaccinating newborn, like you said, for Hep B, when like what are we doing? Other countries don't do this. Why are we doing this? So I think not just as a state, but as a country as a whole, we are finally looking at all of this. And the one other thing I remembered that you said was about home health care. I know, and I have my staff here, I know that we raised this, but last session, I can't remember the number. I don't know if y'all remember, but I know that the per hour rate did increase. So if you have not seen an increase in that, then that is a problem, because we...
It's really been $60 Medicaid rate for the last over 12 years. So I just wonder.
we would have to look into that. And I'm not on appropriations, and so that's where all of that is decided, but we do hear about it in human services all the time. So I would have to get back to you on that answer, but I know that overall the rates were raised. So
Can we go up to the front for our next question, please? Thanks so much.
First of all, God bless all of you. I'm a mom. My son got diagnosed with Crohn's at 20, and he's on biologics, so we're all speaking my language. And I 100% believe that our youth have been poisoned and have a lot of these affiliations because of the additives that have been in their food. So I cannot applaud you more for that. I wasn't even going to get emotional on what my problem is. But my question is, because we've gone through the medical route, but as well as a holistic route, we really did Western medicine along with holistic medicine. And he's had a really good outcome so far. But the out-of-pocket expense to cover the holistic side, not just so, I'm just curious, like when you talk wellness, does that include holistic when we're talking about things that will help heal the lining of the gut? That, you know, could be a slippery elm root that is not, you know, a $600 pill that you have to get paid for. But is there a conversation at the level that you're at to be able to bring holistic as a cost that you could also cover?
The goal.
I'm sorry, and then, you know, I think my son, because of his advocacy and what he's doing, would make a great employee, as a matter of fact. So I will give you my business card when we're done. He graduates from Texas A&M May 7th.
I love the real-time recruitment. Never
miss a chance.
I'm so sorry to hear about your son, 20 years old with Crohn's disease. That's really tough, and that's a lot for a 20-year-old to go through. And so I applaud you for trying out any way you can. But this kind of goes back to like Secretary Kennedy and saying, take back your health. I mean, you and your son are the only ones who are going to be able to take back your own health. You have all the incentives in the world to do what is right for you and your son. And there doesn't need to be a third party other than your physician who's helping you figure out what to do with that. And they certainly shouldn't control your health dollars. So, you know, at a think tank, we can say, you know, the sky's the limit. I know it starts getting a little bit of a limit over here at CMS and at the State House. But I'd say, like, really, there are so many ways to be able to make your health dollars, of which you pay already tens of thousands of dollars each year unused, really being able to use those on what you think is going to drive the highest value for the health of your son. And so I'm totally with you. I think anything that is promoting or preventing or treating healthcare, and you find that there's value in that, your health dollars should be able to follow.
One thing I would just point out really quickly is there's a program that we announced at CMS. Actually, Secretary is a big fan. It's called MAHA Elevate, and it is a program to pilot and to test alternative treatments, and we have to build an evidence base before it can be formally covered. But this is kind of the pathway to do that. So if you're talking to some of the providers, like, you should tell them about MAHA Elevate. The application deadline is coming right up. I think it's next week.
No, I think that's incredible hearing about MAHA Elevate, because I share the frustration, which I know a lot of people have. Outside of diagnostics and lab work, there is nothing that insurance has covered for my health or my family's health that has helped. It is everything that would be it is all out of pocket. Insurance covers none of it. So I share the frustration, and I know families, not just Texans, but across this country, are having to seek treatments and providers that do not take insurance, procedures and just different things that are not covered, even as simple, like you said, slippery elm, whatever it is that is not covered by insurance, to help their family for whatever health issue is, whatever it is that they have. And so it's just, I know I'm sorry what your son has gone through. It's just, there is sadly numerous, hundreds of thousands of families like yours. And so the MAHA Elevate, that's really, really incredible. So hopefully we will start to see things like this covered soon.
Can we go to our influencer in the front, please? This, I think, will be our final question.
Thank you, ladies. You're amazing. Like, I want to be a friend of all of you because it's really cool to be inspired by people that just don't talk about things, but they're doing things. And it's never going to be enough, but, you know, you're doing your best. I migrated here to the U.S. Back in 2013, and it's, 2026, and I still don't understand the healthcare system in the U.S. And every time I say this, people tell me, don't worry, I was born here, and I don't either. So, you know, I live in San Diego, so I cross the border to Mexico, and it's unbelievably different because they have technology that we don't have when we go to the doctor. And to me, it's amazing because, I mean, it's crazy. It's just because I pay as my health insurance is $400 a month. And I go to the doctor, and I see a doctor just typing on the computer. Okay. And I want the doctor to touch me and do something, but no, they don't do much. And, you know, like, it's true. And I went because maybe it is not a chronic disease or anything, but I was having some marks in my face, and the doctor was like, oh, that's cosmetology. I go to Mexico, and a dermatologist prescribed me medicines, and my sun marks went down 90%. So little things like that. I had high cholesterol, and here the doctor was like, do yoga. Over there, they gave me a plan, and I lost 15 pounds in the first month. So, you know, those are little things that I don't quite understand why, if we're a developed country with advanced medicine and healthcare, what's happening and what we should learn about that.
The MAHA Elevate is kind of what you're, I know that there's people that travel outside of the country, like you said, to Europe, Mexico for medical treatment, when that is absolutely insane, and we should not be having that. I know that there's certain providers here in Texas that have certain tech and machines in their office that are very rare for the US, but are very common in places like Europe. And so Americans and Texans should not have to travel outside of Texas or the US to seek and get the best medical care. And so I think I said it goes back to the MAHA Elevate thing, which I think is incredible, and hopefully that brings more innovation and other things that other countries are doing.
And this is a shameless plug for something that AFPI and TPPF have both worked on together, is called direct primary care. And so learning how to push out more models of care. So what is like a $60 or $70 a month doctor that you pay for, you can text, you can call, you can send pictures of whatever's, you know, afflicting you. And it's a way more simple kind of model that was, the president signed into law a way to make it even easier for people to enroll into it. And it's really cool because for people like you who are trying to figure out the complexities of the system, you've got a direct primary care doctor who will charge you $60 a month, and you can text them any kind of questions that you want instead of having to go through the rigmarole of using your insurance or going into a doctor. And that's something that TPPF, I know, has worked on for a really long time.
Indeed. Well, we unfortunately are out of time for questions. I do want to shout out the rest of my fabulous healthcare policy team, my policy director, Dr. Cliff Porter, my policy analyst, Brooke Garner. If y'all have more questions, please catch one of us or other TPPF experts and ask us. We would love to talk through these issues with you, learn from y'all's experience, try and share some of what our research has taught us. But in the meantime, thank you all for a wonderful panel. There is huge opportunity for reform in healthcare. The time is now, and Texas is prepared to lead. Thank you all so much for coming. Thank you for attending. Please help me in welcoming our panelists. Thank you guys so much.